Just before I start, just for those that aren't aware of what the Mackinnon Project does, so we're a group of veterinary consultants that work out of Melbourne Uni. I'm located at Tabletop though, and we provide sort of whole farm consulting on anything from animal health, nutrition, pasture management, systems, economics, the whole range of things. We've got consultants there that specialise in different areas. We also do teaching within the uni, and we do a whole heap of on-farm research, so applied research with farmers as well. So I was asked today to have a chat about some animal health issues, and I thought coming along to Grant's farm to talk about containments, I thought I would cover some of the animal health conditions that you might see in containment. Please feel free to ask questions along the way if there's any questions. I do realise that I'm standing between you and lunch, so I'll try and move along pretty quickly. Grant touched on a lot of things that can happen in feedlots, and I think one of the things that I've learned along the way is taking advice from producers that are doing things really well. Like, we can stand up here and tell you, you know, all the science and background to things, but if you've got a producer that's doing something really well, that's where you take a lot of your information from. We're here to provide a bit of the science and the backup to that information that you can take from those producers. So just what I'm going to touch in the first part is some of the common animal health conditions that you might see, some of the other ones, guidelines for induction, and Grant touched on that really well, so I'll just fly over that. So going to look at acidosis, shy feeders, which Grant touched on, and polio, so vitamin B1 deficiency. So in containment feeding and feedlots in general, I guess the death rate that we should be aiming for is less than 1%. With long-term feeding. So, you know, if you can stay within that guideline, then you know that you're probably not running into any animal health issues. If you start getting beyond that, then you need to probably start looking at what are you doing management-wise that might be increasing that death rate within your containment or feedlot. So just quickly on shy feeders, you know, this is one of the most common issues. Grant said that over time he's had this reduced, and I think probably a big contributor to that is that he feeds them in the paddock for a long period of time before he then puts them into confinement. So and then he picks off the shy feeders before he's putting them into confinement. And we particularly see it if we've got a large number of stock in the pen and inadequate roughage. So Grant's introduced more roughage, potentially a reason why he's seeing less shy feeders in paddocks in his containment. Acidosis is often the second most common issue, but you know, with careful management, careful planning of induction, having roughage on board and following those induction guidelines, you're going to reduce the risks of acidosis on your, in your feedlots. And then polioencephalomalacia, vitamin B1 deficiency, we get this occurring after long-term feeding, often if there's a limited supply of roughage in the pens, and I'll go into more details about how to treat that. Some of the other common ones that we might see, hypocalcemia, particularly in your ewes that are greater than 5 years of age. So if they're in feedlots while they're pregnant, try and avoid any kind of handling, and that's just in general. I mean, it doesn't matter if they're in feedlots or out in the paddock. We try and avoid that handling in the last month of pregnancy. And supplying limestone mixed into the grain, or like Grant does, he's providing a loose lick in those little feeders, protecting it from the rain. So 50% lime and 50% salt, and we don't really need to add the cause mag. That's more of an issue like with cattle with pregnancy toxemia and those sorts of things. I mean, grass tetany, sorry. Pregnancy toxemia, you know, if you've got them in there while they're heavily pregnant, trying to get them out in the paddock before they get to that stage. Campylobacter abortion, so Vibrio. This, we say if you're an early lammer and you've got maiden ewes in pens or in feedlots already, probably not worth trying to vaccinate them against Campy. The reason why we would suggest it, particularly in those maiden ewes in confinement, they're in a confined space, they haven't been exposed to the bacteria before, they might get exposed in that small space, and that's when you might get an outbreak. If you're a late lammer from now on, so for Grant's case, for example, it might be a consideration in your maiden ewes to think about vaccinating if they're going to be in confinement for the next number of weeks or months. Oops. Just some other ones that you might see. Pink eyes, in cattle. We do get sore eyes in sheep. It's not pink eye particularly. Fly strike, vitamin E deficiency. So in weaners that have been off green feed for more than 3 months, you might start to see vitamin E deficiency. So that's where, like white muscle disease, so they start to, they might be lame, they might look tucked up, not putting on the weight that you would expect them to be putting on. So maybe vitamin E deficiency. As soon as you let them out for a little bit of green pick, they'll replenish their vitamin E very quickly. Scabby mouth in weaners, we try and not put weaners into containment feeding, but if you have to. And worms. So particularly after you get a little bit of rain, that's when we're going to start to see a big pickup of worms, particularly, barber's pole, and I'll touch on barber's pole a little bit later. Some less common ones, so pulpy kidney, most of us vaccinating regularly, like yearly, so it's not necessarily a problem. Salmonella, Grant mentioned he had that 1 year. Animals that are, if they're on the verge of acidosis, it increases their susceptibility to diseases, particularly salmonella. If you get a change in weather, all of a sudden we get a cold snap, and they're a little bit stressed, we might see, you might see salmonella. You get high death rates, scouring sheep. Yeah. Listeria, if you're feeding silage, you might see listeriosis. Vitamin A deficiency. Sometimes in weather, blockages, so urolithosis. So that's when we don't have the concentration of phosphorus and calcium right, and not enough water or salts in the water. You might see blocked weathers. So that can be a problem. And sometimes pneumonia, so there's a lot of dust about, and they're a bit stressed from on the verge of acidosis or those other sorts of things. Yeah, so I think sometimes with pneumonia might go under noticed, and it, if you're trying to production feed something and they're not necessarily putting the weight on you would expect, potentially you might have that going on in the background, and you might not necessarily see any clinical signs, might be a bit of going on. So I'll just flick through this because Grant has touched on a lot of this. So, imprint feeding, pre-treatments that you might need to do, drafting into weight groups prior to going into the feedlots, drafting off those ones that might be shy feeders or the lighter ones and managing them differently to the main mob. Careful ration formulation, so making sure the group of animals that you're feeding, you're meeting their energy and protein needs. Having good quality hay or straw available to them, and Grant went through that. Introducing them to concentrates. So I've got here 2 to 3 weeks before. Grant's had experience that it needs to be longer than that to ensure that you're getting rid of those shy feeders and that they're completely onto those rations prior to going into those feedlots. Slow transition, and then so this is with hay. So they're talking about ad lib. I'm not sure why I put that one there. Roughage, so super duper important. 10 to 20% of their ration. 1 kilo a week per head is a good baseline to work off. Minimise stress as much as possible so that they're not increasing their risk to other diseases like salmonella or pneumonia. Avoid rapid change in the diet. So, if you have to change feed sources, making sure it's a transition over a slow period of time, which is all, common sense. Weigh and redraft, or condition score and redraft the mob, so you're getting rid of the shy feeders and managing them separately, or running them down the laneway like Grant was suggesting and drafting off those ones that don't keep up with the mob. Always monitoring and having a hospital pen or a paddock to get those sick ones out into. And making sure that when you release sheep out of the feedlots, that they are fed before they go, because you don't want them to go out into a Phalaris paddock that might be partially stressed and for them all to topple over with sudden death or something else. So making sure that they don't gorge themselves when they go out in the paddock. So acidosis, I'm just going to touch on this, just give a bit of background, and most of you probably already know. So they get a high dose of grain or some kind of high carbohydrate source. The carbohydrates ferment rapidly in the rumen. We get increase in bacteria that produce lactic acid in the rumen, and that's when we get acidosis. And so you might see the early stages of acidosis where they're uncomfortable and they're walking around, and then if that lactic acid moves across into the bloodstream, that's when we really start to see, sudden deaths and more serious issues with acidosis. If you can see that picture down on the left-hand side, that's a normal rumen. So nice, papillae in the rumen, nice and healthy if you're cutting them open. And then this one on the right here is a denuded. So the papillae are quite small. They're starting to come off. It's starting to come away from the wall in some places here. So an unhealthy rumen.
The trouble is it never recovers.
Yeah, and so I've got a picture moving on of a scarred rumen for what it looks like. And the other thing that can happen here is they start to get abscesses in the rumen wall, which, you know, you think you might be past the initial part of acidosis, but they just never do well down the track because their rumen's not able to work properly. I think the thing is just to be aware that that can happen. So if you start to see something going on in the mob, then you can put it down to the fact that it's probably because maybe you've changed varieties and then, you know, maybe aiming not to stress them too much in that time beyond that. But yeah, just managing it, being aware that it could potentially happen. And so just some clinical signs, and everyone's probably aware of it. So you might see some changes in fecal consistency. You might see lameness in the days afterwards in your mild cases. And so moderate to mild, they'll go off their feed. They're looking uncomfortable in their pen. You know, they're standing off from everybody else, so they're not looking happy. And then your severe cases, obviously recumbent and death in those cases. So just some work that was done by Nick Linden, looking at fecal consistency. So, you know, obviously a 1 and 2 is probably pretty normal in the pen, but once you start to see 3, 4s, and obviously 5 is probably quite severe, but just being aware when you're moving through the pens of fecal consistency. And then we just spoke about, you know, rapid introduction to grain, change of source, change in type leads to, you know, acidosis. Obviously the sudden increase in availability. Prefer to have troughs over self-feeders because they obviously can get a lot more from a self-feeder. Even though you're trying to restrict what they can actually get a lot more. Weather also, you know, snap-free, a cold day, they eat less. And so then the next day, you know, they go and eat a whole heap or whenever they're fed next. And ration details, so not enough fibre, cracked versus crush, which in sheep, you know, we don't do that, but in cattle. And then we talked about the different starch concentrations, so which grain's more at risk than other grains. So obviously, and Grant mentioned that before. The other one to put on there is corn as well. So corn's becoming a lot more common to feed out. So it's pretty safe, corn. Yep. So along the lines of your oats and barley. They talk about, is it a 30% loss?
That much?
Yeah. But like, I mean, John Webb just talks about to accept that loss and not necessarily going to the efforts of going and getting a roller to crack it. Then treatment, so obviously varies with the situation and the severity and the mobs. But, you know, if you've got, you know, on mob size, increasing their roughage, and potentially if you've got a problem, reducing that grain to the time and then reintroducing it back up again. You could drench them if you had an accidental, they've got accidental exposure, access to it, or you've miscalculated the formulation. Drenching all the sheep, or having it in their feed, water source at 1%. So working out the size of the trough and adding it in every 3 to 4 hours.
What about adding it, so I can't just add
into their grain? Yeah, I mean, they do that in dairy cattle. I don't know that it's, and Grant might have better comment, but they don't talk about doing it in containment feeding or feedlot feeding.
Putting anything on the grain is it doesn't run properly. So we've tried putting lime on grain, and then you go to feed it out, and the bloody stuff won't run properly.
Yeah.
And so the calibration of your machine's all wrong because it's not running properly. So you're better off to not have anything on the grain.
It binds up in your self feeders and you get bridging and all other pieces happening if you're using feeders.
And I think really what we should be looking at is just we should be managing it properly to start with, rather than actually trying to have something in there that's trying to cover it up.
You can use Escalon and all those additives to stop the acidosis outright, but the problem is you've got to keep putting it in forever.
Yeah, and it comes at a cost, doesn't it?
Yeah, the cost becomes quite high, whereas you can, so it's just a buffer that stops the acidosis building up. better off to get them acclimatised
Yeah.
slowly, and then you don't have the cost of the ongoing stuff.
Yeah. And then, yeah, if you start to see individual cases that are more of your moderate to severe and they're high value animals, then maybe getting your vet out to, you can, do IV injections and rumen transplants and all sorts of fancy things, but, only if they're valuable animals. So like we just said, prevention is better than cure. So trying to manage, meeting those guidelines for induction and management. So shy feeders, when Grant touched on this a bit, so shy feeder is an animal it fails to gain weight or gets loss of weight despite you having feed there available for it. There's been a lot of research done on it and different reasons why we might get shy feeders. So it might be behavioural, they're just actually frightened of the feeders that are there. And so it doesn't matter what you do, they just will not go to that feed. It just won't happen. They might be scared of, so the feed or the environment that's there. Social hierarchy, and that's what we probably all sort of think. It's because you've got your more dominant animals that are pushing to the front all the time. Dietary, so we spoke about making sure there's straw there for them, making sure you induce them into the feedlot properly. And then other diseases that are going on as well, so might be vitamin A deficiency. I didn't say back at the start that often with shy feeders, we'll see them in that first period of being in a feedlot, or if they've been in there for a very long period, we start to see them at the end of that period. If you start to see more than 5% in that mob, in that pen, then you need to really consider what you're doing. It might be you need to have a look at the ration again. Maybe they're not getting enough straw. It's something that everybody needs to manage. Grant spoke about how he manages it here, but everybody needs to have a way of managing shy feeders because it's inevitable. It's going to happen on everybody's farm in their feedlots or containment feeding. And drafting them off regularly, separating into smaller pens if you can, feeding 2 to 3 times a week. Grant said 2 works fine for him. Having sufficient space, sometimes mob size. So, you've got to have the space to be able to have small mobs. So if you don't have the space, then you have to have bigger mobs, and roughage as well. And another important thing with roughage is it's got to be at least the size of their muzzle wide. So you can't go and have chopped up stuff if you've got a total mixed ration or something and think, oh yeah, I'm putting the roughage in there. If it's chopped up smaller than that, it's not effective fibre. So it's got to be what they talk about, the tickle factor. So it's got to be enough to stimulate the rumen to work.
So you don't feed them chaff?
No, well, yeah, I mean, chaff's chopped up pretty small, but yeah. So having it at an effective length is really important. I just chucked this in here. We don't recommend it at all. Even if you have to, we really say don't lamb in containment lots. You'll just get mismothering, you'll get lambs, it becomes a disaster. So really something that people should avoid if possible. Some of our clients in the Western District during lambing last year, used super spreaders to spread the feed so that the ewes didn't, pardon?
The cereal grain?
Yeah.
I've heard of doing it in Lucan, yeah.
So that
A lot of success with favour beans because they don't waste it.
Yeah.
Bigger, and the sheep love it.
Yeah.
And they'll find it,
Well, because the sheep don't all have to go as far, but also if they have to bring their lambs, they're not all bringing them into, where everybody else is and getting lost. So yeah. Just a little bit on polio. So the clinical signs that we might see. So stargazing. So this is a classic sheep stargazing. So head arched back and quite stiff. You might get So they're incoordinated, stumbling around, head pressing, and then as it progresses, you might get apparent blindness in those sheep as well. And then also just a bit of how it is caused. So once again, high concentrate diet or sudden change in diet. We get a change in the bacteria in the rumen. These bacteria produce what's called thiaminases, breaks down thiamine. The rumen doesn't absorb the thiaminases, and you get thiamine deficiency. So we instantly remove them from the feed lot and treat them with vitamin B1, so thiamine. And you can do it intravenous if you've got a vet, but you can also do it intramuscular as well for yourself. Follow up every 6 to 8 hours for 3 to 5 days. And often a diagnosis is confirmed by the fact that after 24 hours they're recovered. Anything beyond that would require euthanasia. So I'll just touch on a bit of the background of the parasite and the distribution, emerging issue, how we might manage it, and drench resistance, because I think having to manage barber's pole is exacerbating our use of drenches, or increasing our use of drenches, which is really putting pressure on drench resistance and the effectiveness of drenches. So just a bit about the parasite. It's known as Homunculus. People talking about it. It's also known as Homunculus. You can actually see it in the abomasum, which is the true stomach. So it looks like this. So red little worms. So you will see it in the abomasum if it's there, whereas you can't see the other worms very easily at all. And it's in many species of livestock, so sheep, young cattle, goats, and various different wildlife as well. So just a little bit of difference between barber's pole and your scaleworms, because traditionally here we don't really see barber's pole that much in years gone by, but the last 3 or 4 years it certainly has risen its head. Sucks blood. It doesn't cause, scaleworms don't suck blood. Clinical signs, so you'll see anemia, which is pale gums, pale, like if you pull their eyes down, it'll be pale on the mucosa under their eyes. Bottle jaw, so that's where you get the swelling, like the fluid accumulating under their jaw.